My name is Jeff Gander. I'm a pediatric surgeon. I work at the University of Virginia Children's Hospital in Charlottesville, Virginia, excuse me, in Central Virginia. Um, I also, as part of my role as a physician, I also educate medical students. I'm in charge of the medical students when they do their surgery rotation. In addition to my professional life, I have a wonderful family, three young boys, a wife who is a nurse and also a full-time swim coach. Um, and yeah, those are most of my background, I guess I would say. Some of my professional values are always do the right thing for the patient. I spend uh, my whole day meeting families, meeting patients, trying to see how I can best help them, whether that's with surgery or with medicine or with what other options they have for treatment, whatever their condition they have. But I always live by do what is the right thing. Personal values would just be treat other people well. And I would say one other personal view that was given to me through my family is to never quit, never give up because something is hard. You may not be good at something just yet, but with more practice and experience, you should be able to do that task. I believe that physicians and medical providers have a duty to take care of the whole patient. They may be coming to us for a complaint such as a cold or a hernia or to adjust their medications, but we really need to make sure we know everything that is happening in their life so that we can help them. And one of the ways to do that is screening our patients and their families for food insecurity. We may not necessarily know, or just by looking at the patient and looking at their family, whether they have problems getting healthy and nutritious, affordable food. And so I believe it's really important that we ask them, and that if they do have food insecurity, having an on-site pantry or a way to get them um, food that particular day, or even information about where they can go to get benefits and to get other food is really important. So I think all providers should, no matter if you're in your office or in the hospital, should be screening our families for food insecurity so that we can help them as much as possible. In my personal life, healthy foods are very important. I have three young boys who are picky eaters at times, but it's important for their emotional growth, their physical growth, to get healthy, nutritious vegetables, fruits, meats, uh, uh, just to help them as they go through playing sports and doing school activities. Trying to be the best person they can be. And so my family has a small garden in our backyard that we try to grow some vegetables. Um, we support our local farmers markets and local grocers. I take care of children who have a lot of surgical needs. That may be something like repairing a hernia, removing their gallbladder if they have an infection of their gallbladder, removing their appendix for appendicitis. Um, but what I've realizing lately is more and more of my young patients, especially adolescents, have obesity, but it also makes their recovery harder for them. And it also can lead to a lot of long-term problems from obesity, such as diabetes, high blood pressure, and heart disease. In talking to some of my patients, I asked them, "Well, tell me about your physical activity, about what you eat." And a lot of them will tell me that they try to stay physically active, but a lot of the food that they have is cheaper processed foods that they either get in convenience stores or at fast food stores because it's hard for their family to afford um, certain fruits and vegetables because it's just too expensive. And so they rely on um, processed foods and fast foods just to get any sort of meals. At my job, we have an on-site food pantry for any of our patients who are experiencing food insecurity. So I get a chance to talk to a lot of families about uh, if they are in need of um, if they're in need of any meals, or if they're in need of are using our pantry or any other benefits that they may be eligible for. I remember talking to one family about what food pantries they have access to, or um, uh, what other options they have through their SNAP benefits. And this particular mom said, it's really hard because my rent is so expensive. And to now try to stretch my dollars the dollars I have left over to stretch for food is very difficult. So I definitely hear from families say from time to time that, yes, they want to eat healthy, nutritious foods, but they don't always have the means to be able to afford it. I'm very concerned that policy decisions are going to affect our children's ability to eat a healthy, balanced diet. Cuts to SNAP, cuts to school meal programs are going to have a significant impact on the development and growth of children. Many of our children and my patients rely on the school breakfast and school lunch program. That may be the only reliable meal they're going to have that day. I think it's really critical that we continue to fund these programs to help our children, help them to get a healthy, nutritious breakfast, a healthy, nutritious lunch, so that they can learn and play and develop as best as they can. A Virginia that centers the needs for young people would show that we care about our future. It would be providing universal meals to kids during school hours. It would feel wonderful that we really do care about our children and what their future will be. We should not be making decisions for other people. I want the people who are affected most to be at the table and discussing what they think would help them. Virginia legislators should work with our farmers and families to help develop a local sustainable food system that benefits all citizens.